So if you're coming in to get a cast, you should not be worried. This process, it will be as quick and simple as possible. We're just going to put your stockinette on and wrap you up with some cotton and turn it into whatever color you'd like. And it's only going to take about 10 to 20 minutes, and we'll have fun while we're doing it.
Oftentimes a cast will feel a little snug when it's first applied, and then over time it kind of relaxes and won't feel as snug or tight. It's important to realize that that's a normal thing with a cast. Now, that shouldn't probably last more than a day or so. So if the cast continues to feel snug or too tight after that time frame, we usually advise the families to give us a call.
Check to make sure that the cast is not too tight by a couple of different things. You look at the color of the fingers or the toes. You want to make sure that they're pink and warm with good circulation. How you check circulation is, I think we call capillary refill. If you push the blood out of the end of the finger, it turns white, and then when you release the pressure, you know you have good circulation when that blood returns to the tip of the finger in about 3 to 5 seconds.
When caring for your cast, and in order to stay comfortable, remember to keep the cast clean and dry and keep the cast elevated. Don't scratch or use lotion in or around the cast. Inspect the cast daily for cracks and rough edges, and cover rough edges with moleskin.
We want you to enjoy your life and participate with your friends and at school if they are on the playground and at recess. What we like to say is please keep their feet on the ground. The risk is there for additional injuries, especially when there's a cast involved.
When a kid comes to have their cast removed, we start out by explaining the process. We say, we're going to use the cast saw. We like to call it the tickle machine because it vibrates. It is loud, so we do have the headset you can wear to help reduce the sound. We like to demonstrate, and we put the cast saw kind of up against our hand so they can see it doesn't hurt. And we do tell them, you may feel a little bit of warmth. It may feel funny, it may tickle, but it won't hurt.
If we feel that there is a distraction measure needed, we bring in the recreational therapist and they do the distraction for us, whether that means an iPad or just talking to them or holding their hand for comfort.
When the cast is removed, it's most likely that the skin is going to be very dry underneath the cast. It's important to not scratch that skin. The best thing to do is just take a bath. Let some of that dry skin be moisturized in the bathtub, and then also apply lotion afterwards, and that will eventually improve.
We encourage you to call your care manager with anything that concerns you, but especially if there is any swelling above or below the cast, any breaks in the integrity of the cast, if the cast gets wet, if there is pain under the cast, or if there are any signs of infection.